A very good evening. This is IMED and very warm welcome to you for another episode on IMED. And a little reminder for you too, if you want to watch the previous episodes on IMED, you can visit our webpage www.channeleye.lk and our YouTube channel as well. So we will start off with a new disease today, which is quite prevalent in Sri Lanka. I should mention that. And now, here's something you might know, might not know. And according to the World Health Organization, dengue has emerged as the most widespread and rapidly increasing vector-borne disease in the world. Now you know what we're going to talk about today, what topic we're going to touch upon, which is dengue. And to do the honors on this program, we are honored to have with us Dr. Ananda Vijayavikrama. He is a senior consultant physician at the National Institute of Infectious Diseases. We are honored to have him here with us. Good evening, Doctor, and welcome to the show. And Doctor, let's get into right on with the questions, which is if you could actually give us a general introduction to the disease of dengue.
Yeah, actually it's a very current topic, so I'm glad that you decided to discuss on this topic, because we see quite a big increase in number of patients in the country, especially in western province. So this is a viral infection. As you said, it is the most widespreading vector-borne infection, or an infection which is spread through things like mosquitoes. So it's quite prevalent in many countries in the world, and more so in Asian countries. And it's a viral infection. When this virus enters a body of a human, it tends to multiply and cause various symptoms. Of course, some patients with dengue will not have any symptom. They will not know that they had dengue or they are having dengue unless it is tested.
So they can be asymptomatic.
They are asymptomatic people. We don't say patients, they are asymptomatic people. But then some others develop symptoms. The common symptoms of dengue are the fever, which is generally is a high fever, and body aches, headache, especially pain behind the eyes. And the headache and body aches can be quite severe in some people. And of course, generally this is associated with nausea, vomiting. Some people can have some loose motion, sore throat. Those symptoms also can occur. So in the current context, if you have fever, if you have headache, body aches, think that it could be dengue.
I think the doctor explained some of the symptoms as well. And doctor, say for example, an individual watching the program at home needs to self-diagnose themselves if they have dengue. They might have the question if they have dengue, and how could they do that and actually get themselves proper medical treatment?
Yeah, in fact, in the present context, since dengue is very prevalent in the country at the moment, especially in the western province, if you have fever, that could be dengue. So think of dengue if you have fever, especially if it is associated with headache, body aches, nausea, vomiting. If you have those symptoms, it is very likely to be dengue. So what is necessary is that with that possible diagnosis, what we advise people to do is to do a full blood count done at the end of 2 days from the beginning of the fever. You can do one earlier also, but it takes little time to see changes which are characteristic in dengue. So that's why we say to do this blood count at the end of 2 days from the beginning of fever. And with that, we can reasonably assume, with the results of that, we can reasonably assume that whether this could be dengue. So the best would be for anybody if somebody is having fever with the symptoms I mentioned, to get a full blood count done at 48 hours from the onset of fever, and to see a doctor and to get medical advice.
And doctor, say for example, you suspect that you have dengue. Say for example, a viewer at our homes suspect that they have the symptoms that you just mentioned. what are the do's and don'ts when it comes to, because we see people doing things that they aren't supposed to be doing when basically they have the symptoms. So what are the do's and don'ts?
Yes, Sonal, that's a very important question because as I said, some people with dengue or many people with dengue, when they are infected with the virus, develop symptoms. And some of these patients who develop symptoms can develop a severe illness with complications. And if you do certain things during, especially at home before being hospitalized, then those things can lead to complications. So therefore you have to know what you should not do and also what you should do. So that's your question is very important. The things we say not to do is, first thing is not to exert physically. If you exert physically, if you start doing exercises or walking around, working, then there's a possibility, higher possibility of getting complications. So the physical rest is very important. If you have fever with these symptoms, physical rest is very important. Then another problem we see is because these headaches, body aches, those can be very severe. Some people tend to take painkillers for this. What we recommend is to take only paracetamol for the fever and the headache, body aches, those pains. Generally for aches and pains, we tend to use painkillers like diclofenac sodium, ibuprofen, mefenamic acid, such painkillers. And those painkillers should not be taken if there is a possibility of dengue, because in case if it is dengue, that can cause a lot of serious complications.
Side effects.
Yeah. And similarly, sometimes some doctors tend to give drugs belong to a group called steroids. That means things like prednisolone, dexamethasone, betamethasone. Now such drugs also can cause serious complications if you are having dengue. So therefore, if you have fever with the symptoms we mentioned, it could be dengue. So don't take anything other than paracetamol for aches and pains or headache or fever. If you have other symptoms like vomiting, nausea, then you can have medicines for that, for those symptoms, but do not take these drugs like diclofenac sodium, mefenamic acid, ibuprofen, and also prednisolone, dexamethasone, and those things. If your doctor prescribes drugs for this fever, ask him what these drugs are. You have the right to ask. You should know what these drugs are given for, and make sure that those drugs are not there in that prescription.
Now, doctor, like you mentioned, that you should not take certain types of medications without the proper medical supervision. And if you could elaborate more on how complications could occur if you take those specific medications without the medical supervision.
There are two common complications we see in dengue. One is what is called plasma leakage. Now we know our blood has two main parts, the cells and the plasma, the liquid part called plasma. Now in dengue, some people develop leakage of this plasma out of your blood vessels into your tummy and the chest, and they get collected in the tummy and the chest. This is a temporary thing. However, if there's a big leak, then your blood volume tend to go down, and then your pressure drops. So your organs, the liver, the brain, those organs do not get enough blood, and then you develop complications because of that. And that's a common complication in dengue, and we call this as dengue hemorrhagic fever. Even though we call it hemorrhagic, it's not really bleeding. What happens is this leaking of part of the blood, that is the plasma, into your tummy and the chest. And that, if it is detected early, that can be treated, that can be handled. If you are in hospital, that can be treated. But such complications can become severe if you take the drugs we mentioned before, and also if you exert yourself during the fever, with the fever, or if you don't take enough fluid, then problems can occur. The other complication we see in dengue is bleeding, and in dengue people can bleed. Sometimes they bleed following this plasma leakage, or even without that they can bleed. So therefore that is another complication we see. But again, if you are in the hospital, if these complications are detected early, they can be treated.
And doctor, let's shift our attention towards how dengue responses with respect to, say for example, children, adolescent children, then pregnant women. How does the dengue disease response?
Yeah, in fact, dengue was a disease of children long ago, many years ago, when we were, for example, when we were studying in medical faculties in early 80s, we studied it as a children's disease. But then this age groups change, and now we see more adults and adolescents patients are getting affected. In fact, now those days, 40 years ago, 30 years ago, more than 75% of dengue patients were children less than 15 years of age. But now more than 75% of patients are more than 15 years of age. So it had become an adult illness. Now with that, people of any age can get affected. The children can get affected, of course, and then the adolescents, and we see a lot of young people getting affected.
Doctor, if I may interfere, why do you think is that now adults are also getting symptoms and getting dengue basically because the immunity system?
In fact, we don't know the exact reason, but this change has been shown in other countries too, not only in Sri Lanka, in countries like India, Thailand, Indonesia, in other countries too, this had been seen. The shifting of age group has been seen. The problem we see with this is, we face with this is, now because this has shifted, now pregnant mothers get affected with the illness, and then people with heart disease, diabetes, kidney disease, and so on get affected more. So then in addition to dengue, they have these other problems also. So it's important to manage these conditions properly, so that you need to get admitted when it is necessary, so that we can manage this illness.
And let's move on with the treatments, because we did talk about the symptoms and everything in between. Let's move on to the treatments which is available for dengue. I think dengue is not absolutely curable because it is a virus. It is curable. I mean, the fever will go away after a specific number of days. But what are the types of treatments available for dengue? Say, for example, what are the newest types of development around the world, and the treatments available in the Sri Lankan medical sector as well?
Yeah. Now, as you mentioned, Sonal, it's a viral infection. So then, in all these viral infections, the body produces immunity, and after a certain period, body get rid of this virus. So that happens in dengue too. However, in some patients, before the body gets rid of the virus, certain complications can occur. So it is important. Now, in people who do not get complications, they recover. The whole thing lasts only for a week, and they recover after that. Usually, during this week, we see a reduction of reduction of white blood cell count, reduction of there's a type of white cells called neutrophils, and then the platelet count. That is quite typical in dengue patients. The platelet count tend to go down for about 6 days, and then on the 7th day, generally it starts to go up, or the 8th day, it starts to go up. That's the usual pattern of the illness. And during this period, some people develop complications. So in those patients, we need to give specific treatment after detecting these complications. So depending on the complication, we give various type of salines, various type of other drugs through your veins, and then sometimes we have to give blood. So depending on what we detect, depending on the complication, then we can treat. So it is important for somebody to be in the hospital at the correct time. It is not essential to get admitted once you diagnose as having dengue. Sometimes we diagnose dengue. Dengue can be diagnosed by doing an antigen test also. Antigen test is usually, it should be done within first 3 days of the fever. If it is positive, yes, it is dengue. But if it is negative, that does not exclude dengue, because in about 35% of people, the antigen test can become negative. So negative antigen test does not exclude dengue. So even if your antigen test is negative, still if you have those symptoms, it can be dengue. Therefore, it is important to monitor your blood counts. We take decisions based on your full blood count. So if the blood counts are going down, then we decide to admit you. When we decide, you need to be monitored carefully. when you need to be under supervision of the medical staff, then we decide to admit. It's not on the first day or second day of the fever. So once admitted, if we detect these complications starting, then with the treatment I mentioned, we can treat you.
I think it's very important for you at home watching today's show to admit yourselves right after you get fever. Now, doctor, I have this question where, these days COVID is still, we could call it prevalent, but the attention has shifted a bit. You could call it like that. But how can you differentiate the symptoms of COVID and dengue? Because COVID patients can get a specific type of fever as well. So how could you differentiate the two?
Yes, as you said, the number of COVID patients are pretty low at the moment in Sri Lanka. Of course, we don't know whether it will go up within next couple of weeks or months, but at the moment it's pretty low. Some of these symptoms, the fever, body aches, those can be quite similar in dengue as well as in COVID, and also in influenza. We have influenza also these days, but the influenza and COVID both have more symptoms related to your respiratory or breathing system. With cough, you get running nose, cough, quite severe sore throat. But of course, having those things will not exclude dengue, because sometimes you can have both these. We have had patients over the last 2 years who had both these conditions, the COVID and dengue. And also now we see patients coming with influenza and dengue. So having this cough and cold does not exclude dengue, because you can have dengue while having other things also.
Other things as well. I think that was an all-round answer to the question as well. Now, we did talk about the treatments which is available for dengue, and usually something that we do on iMed is that we talk about the misinterpretations or the myths.
If I may add little things before that, Sonal. Now we were talking about the treatment. Now while you are at home, it is important, in addition to taking only paracetamol for the fever and to have physical rest, it is important to have reasonably good hydration. Now you need to take fluid to maintain your hydration. So it is important a lot of people can't eat. So if you can't eat, don't force yourself.
Doctor, if you clarify what type of liquids that
generally what we recommend is things like king coconut water, orange juice, lime juice, then kanji, jeevani, milk. These are good. Rather, you can have water, but rather than having plain water, this fluid I mentioned are better than having plain water. If you can eat something light, but if you can't eat, that's okay. What is important is to take adequate amount of liquids
and stay hydrated.
Yes.
And doctor, like I said, we do usually talk about the misinterpretations, the myths around society, and break that kind of stigma associated around a specific disease, which is about dengue today. If you could break some myths today regarding or surrounding dengue.
Yeah, I think again that is another important question, Sonal, because as you said, there are a lot of myths around this disease. More so maybe because we had many deaths occurring about 10-15 years ago, and still some people do die. So one of the common thing is that this low platelet count can cause problems. A lot of people are of this opinion. In fact, about 20 years ago, we were also of that same opinion, that this low platelet count can cause problems. So therefore, people tend to get worried when the platelet count is going down. It is not so. The low platelet count per se does not affect.
That's not the case, is it?
It's not the case. It's not the reason for the complications we have. So therefore, when the platelet count is even 10,000, or sometimes it can go up to 5,000, we have seen patients who had platelet count of 0. But those days, about 20 years ago, we used to give platelet to these patients. We used to transfuse as a sort of saline-like thing to give platelet. But now we don't do, because we now know the low platelet count is not a problem. So therefore, we don't try to give things to increase this platelet count. A lot of myths are around this. People tend to give, I've seen people giving this papaya leaf juice, and then some people have, I don't know how they have got this idea of boiling this raw jackfruit and giving that water. These are not Ayurvedic treatment either. So these have come from various myths and beliefs, not Ayurvedic treatment, definitely, not in the Western medicinal treatment also, but people use that. And what happens we see is that people, because of these things, people tend to vomit. These are unpleasant liquids
experiences as well.
Things, and then people tend to vomit. So such things should not be done. And then there are various myths regarding various treatment, available treatment that some people claim that they have cured dengue. In fact, there are businesses also. There are people who sell various sort of concoctions saying that they can cure dengue, but none of these are working. What is important is to be in the hospital at the correct time. And if you are getting complications, as long as we detect those, we can treat those complications.
I think that's a very important message to the general public, which is do not take any types of medications or treatments which are not scientifically based. If it's Ayurvedic or Western medicine, do take that. But other than that, consider not taking other types of treatments. So, Doctor, I did mention that you work for the National Institute of Infectious Diseases in the beginning. Now, what is the approach of the National Institute of Infectious Diseases in controlling the disease of dengue?
We are mainly focused at treating these patients. That is our main focus, being a hospital. But then we do a lot of other things also. So what we do, say if you come to the OPD with fever, then we do an immediate full blood count, and depending on the full blood count, we decide whether you need to be admitted or not, if it is suggestive of dengue. If your blood counts are okay or not very low, then we ask them to go home, and we repeat another blood count next day. And then if it is low, then we admit. And then once admitted, you will be monitored about how much fluid you are taking, how much urine you pass, and your blood pressure. And then from frequently we do your blood test. What we monitor in the blood is a figure called PCV, or packed cell volume, not the platelet count. We monitor this packed cell volume. Sometimes we do it very frequently, once in 3 hours. Sometimes we do in some patients. And then this is to detect these complications. And if those occur, then we can treat those complications. So that's the simple method we follow in the hospital. So generally, people will have to be in the hospital maybe for 3-4 days. As I said, the whole thing generally lasts for about 7 days. If you get complications, then sometime you might have to be in the hospital for a longer period. In addition to treating these patients in our hospital, being a national institute, we do other things. We train health staff of other hospitals also on management of dengue. Doctors, nurses from other hospitals are being trained. And then in addition, we do a lot of other research work also on various aspects of dengue with various collaboration with, we do a lot of research in collaboration with Sri Jayawardhanapura University Faculty of Medicine, and then with some other universities too. In fact, sometimes we go beyond our mandate in treating these patients. For example, now in last month when we had O-levels, ordinary level exam, some of these kids had dengue. So with the support from the examination department, we had the exam center in the hospital too. So some patients, dengue patients, were able to sit for the exam while having dengue, while having treatment, while under our supervision. They were able to face the exam also. In fact, we were doing that for the last 5 years or 6 years. Right.
I think, Doctor, you have our heartfelt gratitude as well. You know, I think that's a very wholesome thing to hear. And Doctor, we have come towards the end part of the program as well. Now, if you have any final message to give out to the general public regarding dengue and to our viewers outside who are watching today's show, this is your chance.
Yes, at present the dengue is quite prevalent in Sri Lanka. If you have fever, headache, body aches, it could be dengue. Think of dengue. If you have fever, if you have those symptoms, it is important to have physical rest and adequate amount of hydration, and not to take other than anything other than paracetamol for the fever and the aches and pains, and then get a blood count done at the end of 48 hours from the beginning of fever. Show it to go to a government hospital, show it to a doctor and get medical advice. When you are, if necessary, you will be admitted and then we can look after you. Otherwise, if it is not necessary, you have to still repeat another blood count. It is important to remember that dengue is prevalent, and so you can have dengue. In addition, it is important to prevent the spread of dengue also, because it's spread from your surrounding. So because of this monsoon rains, we get this water collected in many things, and that is how the mosquito spreads. So make sure that you get rid of these places where water can get collected, so that you can prevent the mosquito breeding in your surroundings.
I think we did the whole point of program of IMED is to inspire even one individual to actually get an idea about how serious a specific disease is, and dengue is on the rise. You have to keep that in your mind, and we have to wind up today's show, Doctor, because the time is a barrier for all of us. So we did have with us Dr. Anand Vijay Vikrama, the Senior Consultant Physician at the National Institute of Infectious Diseases, and you have our greatest appreciation, Doctor, for being here, given the situation of the country as well. Thank you so much for being here.
You're welcome.
And with that, we conclude today's program of IMED. Thank you so much for keeping tuned in. Keep tuned in as always. Let's move on with the program. So with that, we tell you bye. Have yourselves a great rest of the day.